good, right? And our bodies function by fluid flow. So decompressive therapy is what kinesiology tape is. And it has the same, if not better effect as this woman wearing one heck of an uncomfortable arm sleeve post-mastectomy. So we're now lifting the skin, allowing fluid to flow post-cancer and lymphatic removal operation versus putting on a sleeve that doesn't allow any life into that arm and is very, very uncomfortable. So the papers on this are fascinating. They're also in my folder. It applies to legs and all that sort of stuff. But if you get a nice big contusion this week, consider it the kinesiology taping God sending it to you, because they want you to do this to it. And that's to create a basket weave around the area. So whenever you have an acute injury with visible bruising or swelling, this is how you tape it. We've shifted gears now. I taught you guys pain taping. I said stretch the area, stabilize, decompress for pain. Now I'm saying if it's an acute injury with visible swelling and edema, you create a basket around the area for 12 to 24 hours. You replace tape very regularly to help improve the healing of this.
No stretching.
No stretching, just put some tape on.
If you were using the tape, would you use like Russian cops like Zoom
No.
recovery for sleep night?
I'm sure a lot of people do. Personally, me, I wouldn't, but I know quite a few of our guys who do. So, yeah.
Yes.
Tape or the compression, yeah.
Yes.
Well, I'm sure you could do both, you know, when you think about it. I'm sure, I guess it just depends the situation at hand and what the emergency is for the next day. You know, because we'll do a lot of leg pumps where they're taped and then they're wearing their, leg pumps as well. So this is the basket weave. And the reason it's interesting because I don't know if there's the best answer yet as to why we do these fingers of tape, no tape, tape, no tape, tape, no tape. What I was taught is that I'm going to tape like this and I'm going to direct all the fluid flow to this base, but there's nothing to support that because all we can really see on that ultrasound is that where there's tape, it creates this lifting effect. So, this is interesting because there are instructors and we meet twice a year and we all debate this, and some of us would say, a couple of the guys, one is a PhD and he does papers on kinesiology taping, would say that it's the gradient that you create, that the area where there's tape there's less pressure, the area where there's no tape there's more pressure, and this sort of pressure gradient allows the fluid to feel better. Here's what I can tell you. I didn't believe it, so I took my own acute inversion sprain and just mummified the thing because I thought more tape. Wouldn't anybody just say, well, why don't you just tape the whole thing?
I was
It
just
was
saying
so
that was good. A lot is better.
painful. And so in this acute sort of region where you've got so much swelling and accumulation happening, I can tell you in my clinical trial of 3 people, 2 of which were paying patients willing for me to experiment on that situation, it didn't make a difference. And the only thing it was a little more uncomfortable to initially wear. So these applications here stay on 12 to 24 hours. They're removed. You re-crisscross your patterns. You will see pre-cut strips for this, but really it's not that, it's not that hard to do. You're taking a piece of tape and you're rounding the edges just like this, okay? And then I'm going to create like an octopus. So I don't even cut 4 strips because the more tiny strips I have, the more mess I'm going to be in. So in this sort of scenario here, I've got 3 strips. I rip my tab, I anchor it down over the area, okay? And then here's what I do. I take my tape and I just lay my strips like this. And then I take them and I fan them out. Just like that. And then I'm going to crisscross the basket over that region. And you're lucky if it's a big bruise because it'll freak you out every time you take it off the bruise because it's going to look like this. Every time. So freaky. Our folders of this is amazing. The amount of healing that happens. So this is a lacrosse, this was a patient of mine, lacrosse stick to the thigh. And it would have been a myositis ossificans. First, like the amount of hard tissue in this right after impact was absolutely shocking. So I was taping every 12 hours and changing it up. And this is a 6-day, recovery from it. So that could have been a really, really bad injury that could have caused a lot of other problems. It's really interesting how these sorts of impact, injuries can heal up and then there's other problems that relate from them. So this sort of edema taping application is definitely one to play around with. take, some tape with you guys this weekend, play around with cutting these sort of baskets on each other, or you could workshop that when we end up here like 10 minutes early. And rib contusions, rib fractures, amazing to tape. Amazing to do this over PMS type, symptoms, post-surgical as well. You'll see a lot of this edema taping, but your inversion sprain is like your bread and butter for taping that thing. It's at the bottom of the gravity chain, so taping those is absolutely fantastic. And the hard thing is these little strips will tend to peel quicker, but the great thing is you can just tell your patients to trim it until they come in next. It's not meant that they're going to be running around with this acute, injury that's going on. So these long arm chains that we do are pretty, fun to play around with as well. That's what it would look like post, any sort of lymphatic removal in that arm. And we do it on legs all the time as well. So you could have someone have some sort of injury and they've got swelling through. I had a patient who their doctor said, "You have genetic lymphedema." And I was like, what on earth is that? Genetic lymphedema. And she did. Her right leg was measurably, much bigger than her left. And she was diagnosed with genetic lymphedema. She also had an incredibly anteriorly rotated pelvis on that side, no movement at all through that inguinal region. And I just structurally worked on her, did a lot of rehab, and then I cured her genetic lymphedema.
Wow.
It's amazing.
It's crazy.
But all we did was measure the circumference of her leg, after taping. She was fascinated. She traveled too, so she always taped up like this before plane rides. So that framework for edema taping is just create a basket around the area. Super easy to do, and the reason we're not workshopping it today, obviously, is in the interest of time. I want to allude to some of these things because I think in just alluding to them, even though we don't practice them, I think you guys will probably, it's not rocket science, right? Nothing I'm saying today I don't think is very complicated to go back and start playing around with. And taping posture is amazing. And this is the essence of taping posture, that kinesthetic guidance, meaning tape on skin, is 30 times more effective than anything you're ever going to say or do to your patients. So you have them here and you say, "Joey, I need you to stand up straight." Then I show him, "Joey, shoulders down, blah, 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 activate these lower and middle trapezius," and then you tape him and you are just 30 times more effective in affecting the actual outcome, just based on kinesthetic guidance. So tape on skin, 30 times more effective in actually communicating. This is what we believe as a profession, and wherever you are on the spectrum of this, I've moved a lot more now to, if I could ask one thing of every patient, it would be for them to be active every day, and they'd probably be fine,
What do you think about like the biomechanic posture of sport? As a volleyball player, constantly, would you take them in that postural position, and then like that?
I'm going to allude to that for our level 2 course, so you can see some of the sporting imbalances that are created and how we tape them. So this sort of postural taping application has nothing to do with taping muscles. It has to do with taping skin distortion patterns. And if anything, if anyone has ever read Thomas Meyer's book called Anatomy Trains, which is actually a non-boring read, there's a lot of pictures, and if it can keep me awake, it can keep you awake. And what you'll see a lot of when we tape posture is we use the head, the rib cage, and the pelvis as our areas of reference. And we just basically put people into a neutral posture, and we lay down tape with no stretch. That's the framework. Okay, so we're into a new framework right now. I take somebody here, I put them into a neutral posture, not an exaggerated posture, just a neutral posture, and then I lay down tape somewhere on their back with no stretch, so I know when they go into the unintended posture, the tape is going to stretch. So it's not really that you're going to take this posture this way or that way, because every person is going to have an area of skin that is stretched or distorted a certain way. I try to teach people to go into an exaggerated posture and then come back to neutral, because I don't want them to be in a super exaggerated posture when I tape them. So I teach them to go into an exaggerated posture and then come back to neutral. But this sort of situation is begging for some help. So we just did a plea on our Facebook page to Justin Bieber with his mugshot. We were pleading out to him that he really needed some tape to correct his anterior head carriage. Yeah, and we do teach a lot in our postural taping, but really, as a company, we do a lot of focusing on the upper thoracic spine versus trying to just focus on an anterior head carriage. So you'll see a lot of our taping patterns in this sort of scenario, you know, if somebody's here, we're going to get them into neutral posture. We're going to focus on that upper thoracic region. And so when they translate again, that tape is going to give them some feedback. And you'll see a lot of crisscross postural patterns because as you start to learn the fascial pathways of how stuff connects through our system, it's always crisscross. We know that. When we lay people down, that right shoulder and that left hip, no doubt about it, are connected. And they're connected right through that thoracolumbar fascia. So in this scenario, he's got a postural taping application, meaning he was put into neutral, and he was taped with no stretch. So when he goes back here, he's got to pull from that tape, but he also has a decompression strip, because there's no rules, right? Why not? If he has pain there, why not put a tape over that region? No problem whatsoever. So in here, in a forward translated shoulder, along with some god-awful anterior, pelvic tilt. In this sort of scenario, we put shoulder back into neutral, but lay down the tape from anterior to posterior, and as that shoulder would dive forward, he would get feedback from that tape. And so in this sort of scenario, maybe it's that he sits at his desk all day and really, translates that forward shoulder. I probably now affect a lot more postural taping in bringing the shoulder into my postural taping because the feeling of it, if you play around with this on yourself, just taping your back versus having your arm taped, which moves so much throughout the day, there's a lot of feedback from that shoulder sort of scapular region when you're taping. So in this sort of forward dive scenario, if it's bilateral, give them a man bra. That's what I would do. The brogue. The man's ear with the tape. And if it's really bad, increase your surface area. Right? So you're now taking this sort of postural position, and I can guarantee you in that sort of scenario, it's really amazing how they walk out of your office, and then you're with them for 3 to 5 days. They think about you when they're sleeping and working, but the great thing is he can bend down and pick something up and not irritate his skin and not be restricted at all in a range of motion. That is a really important point. Okay, so when you see these crazy taping applications now, your job is to say that's not so crazy after all, because tape on skin is there as neurosensory feedback, and I bet you any money that that's a postural taping application on that athlete. This Big Daddy tape, I do this all the time. In between scapula, trying to work on scapular protraction, and just lay it down. So they go into a neutral posture, and I lay down that tape. If they're really, really muscly, you just need to make sure that you get that tape really stuck in between those muscles, and fan it out from there. But that right there is some serious taping application. But this right here is probably the most stimulating taping application you could do for each other in here today if you wanted to. Just run your paraspinals. Take a flexion-dominant society and just give them extension awareness. So running 2 strips of tape up and down their back is quite a stimulating 5 days, for sure. And that's a posterior chain that goes all the way from the base of the foot up right into the temporal region, and we're just taping a component of it. So that's a really great postural taping application, and we do a whole bunch of them as well, but you'll see that now, and it's funny because commentators are like, what muscle is taped here? I don't even know. And so we're kind of changing up how people think about this. And when it comes to scoliosis taping, I can't even talk about it because I would shut the door and lock you all in here for 8 hours because it's that exciting. It's that exciting to tape postural distortion patterns for me and see tape actually make changes that I thought only, my God-given hands and brain could do.
Now,
So, yeah.
On that postural aspect there, you're following like that work position where you get the crossover. There's where you want to go like this.
You'll see us in our level
SI
1.
and then L5S1 with a crossover, so let's follow that chain all the way up.
Always. You'll see us always go from shoulder to opposite hip through thoracolumbar fascia. And then every now and then when we're trying to really change a walking or running dynamic, we just do a big piece of tape on the thoracolumbar fascia to create that sort of lifting effect. That's probably the coolest diagnostic ultrasound effect we're seeing right now is we measure that lift, and it's pretty amazing. So I gave you guys today, I gave you pain taping, stretch the area, stabilize, decompress for pain. I gave you edema taping, although we didn't practice it, which is to create this basket. I gave you the concept of postural taping, which was to put them into neutral and lay down some tape with no stretch. And this is what This is how it can go from here. You can take radicular pain. You don't need me to help you. Take the nerve pattern. Don't go by the textbook, go by what the patient says. This, for me, as I flew off a mountain bike and found myself...
Time's over.
Okay? So let me conclude and say the police. Let me conclude, because you guys do have to get out to your break, and say that the neurotaping, scar taping, all that sort of stuff, I planned my flight so I could stick around at the end of today, and you guys can come over and get some opportunities from me in the lobby. That's the diplomatic way.